Hi, my name is Dr. Amir. Today, I'm going to talk to you about migraine. If you haven't experienced migraine pain before, you don't know how painful and devastating it is. It is very disabling that can cause patients to miss time from work or school. Migraine is the most common type of headache, affecting females more than males, especially at a young age. It's also a genetic illness that runs in the family. Most of the time, patients think it's a regular headache and take over-the-counter medication, which might relieve the pain partially, but will not treat the attack. The theory about the cause of migraine is that it's a chemical and hormonal imbalance in the brain. Migraine attack starts with pain on one side. Sometimes there are warning signs before the pain, like blurry vision and visual disturbances, which could last a few minutes. The pain gets worse gradually. It's throbbing and pounding, increased by bright light, noise, or even movement. Patients prefer to lie down in the dark room. They often have nausea and vomiting. The attack lasts from a few hours up to 3 days. Migraine patients have a sensitive personality, are very organized, worry about the others, and very light sleepers. Usually, they wake up with a headache in the morning. What can trigger a migraine attack? First, not sleeping well or not following a routine sleep schedule, like waking up early in the morning or sleeping late. The second one, not respecting mealtime or skipping breakfast. But there are some type of food can trigger a migraine as well, like wine, cheese, preservatives like MSG, or caffeine, either drinking too much or withdrawing from caffeine for a long period. The third one is changing the weather, when either the temperature is very hot or too cold. The fourth one, the migraine can be triggered around the menstrual period. And the final one is the stress. And how do we treat this condition? I normally give my patient a class of medication called triptan, which is a migraine-specific medication. It normally restores the chemical and hormonal imbalance in the brain and reduces the frequency of the attack, and it has better result from the usual painkillers. I normally recommend to the patient to take this pill as soon as they have a migraine attack and not to wait long time until the migraine gets worse. There is another type of treatment. We use it as a preventive medication. Normally, we give these pills on a regular basis to prevent the migraine attack. And recently, we have a new injection we can give it on a monthly basis, and it's showing good result in preventing the frequency of migraine attack. My final advice to my migraine patient: please seek medical help if you're experiencing frequent and a chronic headache. Also respect your mealtime and sleep time. Sleep at least 8 hours per night. Also, you should avoid the triggers I mentioned earlier. And of course, you should exercise regularly and avoid stress and accept imperfections. I hope you enjoyed today's topic. Until I see you next time, I would like to wish you a happy holiday and a happy, healthy life.